All right, today we're putting on our detective hats. We've got a case on our hands, and it's a really common but super tricky one, trying to figure out the difference between a seizure and just, a simple faint. So let's get right to it and start gathering the clues.
So, picture this. You walk into a room and a young woman has just collapsed. It's on you to figure out what just went down. Was it a seizure? Or was it what we call syncope, which is, the fancy medical term for fainting? The clues, they're all right there in front of you, but you gotta know what you're looking for.
Okay, first things first, let's look at the evidence that points towards a seizure. Think of it like this. Every seizure leaves behind its own unique fingerprint, and right now we're going to learn exactly how to spot it.
So what are those dead giveaways? Well, the number one clue, the biggest one by far, is a really fast heart rate. We're talking tachycardia, like over 120 beats per minute, after everything has stopped. Then, you've got the recovery. After a seizure, the person is usually really confused, kind of out of it and super tired. That's called the postictal state, which is basically just the brain hitting the reset button. And here's a huge one. Seizures don't care if you're standing up, sitting down, or even lying in bed. They can happen anytime, anywhere.
But wait, why does the heart rate go through the roof like that? Well, it's all because of something called a sympathetic surge. A seizure basically unleashes this massive electrical storm in the brain, and the body's fight-or-flight system just goes into absolute overdrive. That's what's causing that crazy high heart rate. So yeah, it's not just some random clue. It's pretty much the physiological smoking gun.
Okay, now let's flip the script and investigate our other suspect, fainting, or syncope. This one has a totally different MO, a completely different pattern of behavior. With fainting, position is everything. It almost always happens when someone's standing up. Why? Because fainting is usually about a sudden drop in blood pressure. Gravity makes it tough for the heart to pump blood all the way up to the brain, right? And boom, you're out. And here's another big difference. Fainting usually gives you a heads up. There are warning signs, what we call a prodrome, where you might feel dizzy, nauseous, like the room's getting dark. You know that feeling. And the heart rate, it does the exact opposite of a seizure. It gets slow, a state called bradycardia. Best of all, the recovery is usually super fast. 1 minute they're down, the next they're up, feeling fine with no confusion. So let's put them side by side. It really makes it crystal clear, doesn't it? Seizure, fast heart rate. Faint, slow heart rate. Seizure, any position. Faint, usually standing. Recovery from a seizure, slow and confused. From a faint, fast and complete. And those warning signs, pretty rare with seizures, but super common with fainting. These are the absolute core differences you've got to lock in.
All right, detective, we've gathered all our intel. Now it's time to put it all together and crack this case once and for all. Let's take a look at the evidence. So, here's the million-dollar question. Which one of these findings points most strongly to a seizure? Let's go through the list clue by clue and see what we can eliminate.
Okay, clue number 1. She says she felt weak and lightheaded right before she collapsed. What does that tell us? Well, actually, that's a huge piece of evidence against it being a seizure. Remember that whole prodrome thing we talked about? Feeling weak and lightheaded? Those are the absolute classic warning signs that you're about to faint. So, nope, not a seizure. Let's cross that one off the list.
Okay, what's next? We find a bottle of lorazepam in her purse. Now, wait a minute. That's a drug they use to stop seizures, right? So this has got to mean she has a seizure disorder. Case closed?
Not so fast. This is a classic red herring. See, while it's true that lorazepam is used in the hospital to stop a seizure that's already happening, it's almost never prescribed to prevent them. What's it most commonly used for? Anxiety. So this clue is super misleading. It doesn't really prove anything at all.
All right, on to the next clue. The whole thing happens while she was standing up. And once again, this is pointing us away from a seizure. Like we just learned, fainting is all about position and gravity. Sure, a seizure can happen while you're standing, but it's the signature move for syncope. This clue is screaming fainting, not seizure.
So that just leaves us with one last piece of evidence, and it's this. Her heart rate after the event is 120 beats per minute. 120. That number, that is our single most important clue. And here's why.
And there you have it. That's the smoking gun. That crazy high heart rate after the event, that tachycardia, is the single most reliable sign you're looking at a seizure. It's the direct fallout from that massive sympathetic surge we talked about. Case closed.
So, what's the big takeaway from all this? Let's boil it all down into a handy little detective's cheat sheet you can take with you.
Seriously, think of this as your go-to field guide. You just need to ask 4 critical questions. 1. What was their position? 2. What was the heart rate after? 3. What was the recovery like? And 4. Were there any warning signs beforehand? This simple breakdown gives you everything you need to solve this puzzle every single time. So there you have it. You've officially got the tools of a clinical detective. The next time you're faced with this mystery, you'll know exactly what to look for. And remember, knowing the difference isn't just about being right. It's about making sure someone gets the right help right away. Thanks for cracking the case with me.